everyone. This is your host, Dr. Tomi Mitchell from the Mental Health and Wellness Show. Today, I have the pleasure of introducing Dr. Alice Lee. She is a pioneer holistic psychiatrist practicing in both Utah and New York. She combines the best of conventional psychiatry with integrative approaches, including nutritional, functional, and energy medicine. Dr. Lee is dedicated to addressing the mental, emotional, physical, spiritual, social, and environmental dimensions of health to help her patients achieve well-being. Her practice emphasizes treating the root causes of mental health challenges and empowering individuals to heal naturally and efficiently. Many of Dr. Lee's follow-up appointments can be conducted virtually, making her holistic care accessible to a broader range of patients. With a passion for innovation and patient-centered care, Dr. Lee is transforming the field of psychiatry, offering hope and healing through a truly holistic approach. With no further ado, I'd like to introduce our guest. Dr. Lee, welcome to the show.
Oh, thank you so much, Dr. Mitchell. It's a pleasure to be here.
Yes, it's a pleasure to have you. I was in your podcast not too many months ago, so it's great to return the favor. Is there anything you'd like our listeners to hear from you so they can kind of understand your heart as we talk about this holistic psychiatry approach?
Well, the main purpose of my journey in holistic psychiatry was to help other patients to be able to stop being patients. That means I was looking for real solutions that would really heal underlying causes of what many traditional psychiatrists would consider chronic conditions. And in my journey over the last 20 years, I did find alternative solutions that did allow many of my patients, in fact, the majority of my patients, to be able to stop being patients. And that is what gives me the greatest joy.
I agree. I've heard a lot of people say kind of cynically, like just kind of sarcastically that, prevention isn't good for business. But I wholeheartedly disagree. If we can help our patients be whole and, optimize their health, I think that's so much better. So obviously your approach is quite different from the approach we were taught in medical school and residency, especially you being a psychiatrist. Can you maybe start explaining what's the essence of holistic psychiatry and what really prompted you to approach this practice in this way?
I think the root of holistic psychiatry is being able to look at every individual as unique and from an integrative approach rather than a single bullet like a medication to help, ameliorate a symptom. We're not really ameliorating symptoms per se. We're looking at the symptoms as information about underlying causes. So we're really most interested in true healing and being able to cater the treatment to the needs of each individual through, in my situation, through an integration of psychiatry, functional medicine, and energy medicine.
Yes, I agree. I consider you to be like my big sister. We're because those who don't know me and Alice, we're friends, we're professionals. We connect on a very deep level, and our passion for holistic wellness. And as you said, looking at the root, don't just look at the symptoms as this is symptoms, hence this is a diagnosis. We have to peel back the layers and really find out the root so the patient can heal. So they're no longer in this rabbit, this wheel of just sickness, response, right?
Yeah, I totally agree. I think also, as I've shared with you in the past, the reason why I even got interested in holistic medicine was because I experienced medication withdrawal after I was put on an antidepressant during my third year of psychiatry residency. I was left on that medication for about 5 years, even though, I felt much better after about a week. So the practice in psychiatry is to medicate and then just to leave the medication on board.
Yes.
None of us as psychiatrists really understand the full implication of medication withdrawal once we put patients on these medications for the long term. And when I discovered personally what it felt like to come off just 25 milligrams of Zoloft after 5 years, I realized that this was an area that has been minimized and ignored, just because in psychiatry, it's much more profitable to have chronically ill patients than someone who is coming to you and is healed through the process and then leaves, and then you have to get another patient, you know?
Yes, it's definitely a different approach, but I would say like there's billions of people in this world, and we all have experiences with our mental health as part of living and breathing. So I feel like it's a very fixed like mindset when people feel like, oh, this is bad for business or this is not going to work. But I don't know. I just don't see it that way. You, like many of us in this field, had a personal connection with, your own mental health, which I feel makes you more authentic and passionate because, like you said, 5 years is a long time to get a medication. And then withdrawal can be a challenge, right? And then probably, I'm sure you reflected on your previous patients and you're probably thinking, I wonder what happened to that one. How did this impact this person? And then I would say like the Pandora's box was open, because one of the things I know that you practice in your psychiatry practice is energy testing. And to be frank, it really wasn't until I met you did I really start learning more about it and, quite frankly, being in awe of this. So can you maybe explain to our listeners what exactly is energy testing and how it complements other methods in psychiatry?
Well, this is an area that is very hard for people who've never experienced energy medicine to understand, but the people who have become much more familiar with energy medicine they come to understand it as just another way in which energy medicine serves the clinician. It serves people who are familiar with this approach. But energy medicine has two branches. One is the healing branch, one is the diagnostic branch. The diagnostic branch is using our ability to sense information and being able to link it to a very small biomechanical feedback mechanism in whatever way you are able to link that. And so most of the time, as an individual, those feedback mechanisms has to do with a shift in terms of how our body responds to shifts in energy. With that, you can link our body's sensory system, energy system, to a method by which you can tell what information is true and what information might be false. And if you build repertoire like I did over the last 20 years of different scales and ways in which you can check for functioning, you can use this technique to access information for the patient, just as maybe someone would go on the internet and be able to access information through the internet system. So once you get into energy medicine, it's very much a whole different field of medicine. It's quantum physics. It's like accessing information like on the internet. Whereas, before you actually understand energy medicine, everything is Newtonian physics. You have to hold something, you have to see it. Anything that you check is either a blood sample or urine sample or some kind of sample. But once you get into energy, like the MRI, for example, MRI is using magnetic fields, and you're looking inside the body without having to pry open the body and get a sample. So once you get into energy, you can see inside and understand people's functions without having to take tissue from that body and be able to see what's going on. In case people wonder how useful it is, I would just say that on my website, which is holisticspsychiatrist.com, under medication withdrawal, there's an article that I had published in September of 2023, where I explained a case where I helped someone get off 6 psychiatric medications in a little bit less than a year without any relapse, withdrawal symptoms. And she was fine for, at the time the article came out, it was for 2 years after the treatment was provided without any relapse, and she's remained well. So it's been, I think, Beautiful. At least 4 years now. So, and it was all done through energy testing.
Yes. And I can only imagine the right patient for energy testing is probably someone who is open and willing, or how much does the person's willingness contribute to the success of energy testing and the work you do?
Well, a lot of people, when they come to me, they don't know anything about energy medicine. And so I've developed over the years a way to help people understand the mind-body connection and how energy testing works, how to send energy, how we receive energy, all as innate properties of our energy body. In fact, just recently, I worked with someone who her family was very concerned that she might not be able to understand energy medicine. But when I, taught it to her, she was very open. She understood the principles. So once you're just open to learning, I've found ways in which I can demonstrate how energy works that isn't, it demystifies the whole process and helps to bring it to a practical level of understanding. But I think energy medicine is very hard to describe over Zoom. So for the first part of the evaluation session, I do ask people to come to my office, or I can go to them where it's a face-to-face appointment, and I can demonstrate it to them so they can actually feel it.
Definitely. That's kind of how you demonstrated to me. It was a face-to-face, and it was mind-blowing because this was not something I was exposed to. And the psychiatrists or those in healthcare listening to this is probably something that they're not familiar with because, again, traditional medical model is depression is a chemical imbalance, replace the chemicals, basically. Like, that's pretty much what I was told. There was no other alternative approaches to mental health. But one thing I am finding that more and more people are embracing terms like holistic. They're embracing terms like wellness, where 10 years ago, and I know when you started, it wasn't the thing. Like, people were reluctant. So what do you think maybe shifted in society for people to be more open to this approach?
I think it's a lot of different reasons. I think one is that as medicine is becoming less and less effective at treating chronic illnesses, people are starting to go online and they're able to find lots of information out there that's free that helps them to think of alternatives to their choices. I think over time, chiropractors and acupuncturists and lots of different modalities have become much more legitimized, and their treatments have been sought for by lots of other people. And so as information is now much more freely available, patients are coming to their traditional doctors and asking about, what about this vitamin? What about that? And doctors are actually, in some ways put in a corner and expected to understand these things, because on every supplement bottle, it says, ask your medical physician about these supplements, right?
Yeah.
And so if a doctor knows nothing about these nutritional supplements except to say, don't take them, then of course, patients pretty soon will start to understand it's because they have a innate bias against nutritional support. And nowadays, there's so much information out there about the benefits of nutrition, for example, the benefit of mindfulness and meditation.
Yes.
You can't just bury your head in the sand and ignore it.
100%. I appreciate how there has been research, with mindfulness and meditation and just the many different benefits, which legitimizes what people have been saying in the holistic field. Because for a long time, those who were quote unquote holistic or natural, they were seen as, I'm trying to think what they used to say in residency, like wackos. It was like they were hippies. Yeah. It wasn't embraced. I can tell you that much, at least in my residency program. But I'm thankful that knowledge is becoming more available, because before people would just go to the doctor and the doctor would say whatever they needed to say, whether or not they were well versed in a topic or not. Patients took it as that's the gospel truth. But now, thankfully, and I'm actually happy for this, that there's internet that you can search and question, and then still go back to your healthcare provider and kind of get their feel for it. And if it's maybe not that jam, there's not their cup of tea, hopefully they'll have the grace to refer you to someone else like yourself who is knowledgeable in this process. I know in my clinical practice, when I first started off, I had a lot of patients on like Prozac for like 30 years. They were seniors, or like drugs, multiple drugs. And we talk about polypharmacy. That's something they did talk about in school. And Beer's list, and like things to avoid prescribing in their elderly. But what often happens is someone is put on the medication when they're 30 or 20 going through a crisis, and now they're in a senior's home and they're still on it. And we talk about safety because we can't just pull the plug, right? So perhaps you can share with our listeners how you can safely withdraw a patient off psychiatric medications, especially someone who has been on it. But like you said, you went 5 years, but others are on for 10, 20, 30 plus years. And what are some key factors for success for these patients?
Well, that's the question that I worked on for the last 20 years, like 22 years. So it's a great question. So ideally, if someone hasn't started on any kind of medication withdrawal process, which is really the best way to start when you work with a holistic clinician, you really need somebody with experience, right, to guide the whole process. But in general, I can summarize the first phase would be stabilization and restoration. So you're strengthening the body, you're helping the body in lots of different ways. That's the first phase. The second phase is the active phase of medication withdrawal, when the body has gotten to a place where it's healed enough that the medication starts to be unnecessary in more and more, like gradually increasing layers. And so you kind of very slowly taper down the medication, oftentimes with a compounding pharmacy's help, where you're lowering these medications in small amounts. And the last phase is where you watch the patient and make sure that they're stable for about 3 months after all medications have been completely stopped, and the patient is not on any medication, because within that 3-month period, there's still healing that is changing and shifting throughout the body, and you want to make sure that the person is able to stay stable during that period of time. So when I work with psychiatry and functional medicine and energy medicine, the psychiatry piece is helping me to understand which medications affect which receptors, how they work in the body. Do they block a receptor? Do they stimulate a receptor? Those are very different ways in which these medications work. The functional medicine is all about helping the body rebuild from the raw materials of life. You're working with vitamins and minerals and essential fatty acids and amino acids. You're working to support the glands. You're helping to decrease inflammation. You're restoring the GI system. You want to make sure the hormones are supported. There's a lot of different parts of the body that needs to come together so that the body can be in a better state of health. And as the body is able to rejuvenate and restore and regenerate, then the medication is no longer needed. And pretty soon, with guidance from energy testing, you can tell how much to lower at what point in time and which medications to lower and by how much. So the last piece, the energy medicine piece, is really helpful, because the body isn't just a random, chaotic mix of chemicals. There's information in our body that determines where those chemicals go, and information that decides how these chemicals are arranged to create an enzyme, for example, how methylation affects the DNA and detoxification. So information guides everything, and it is the foundation of the body. When people are exposed to medication for about even longer than, let's say, a month or two, the immune system isn't stupid. It starts to understand that there is a foreign substance in the body. It's a medication, and it's trying to balance the benefits of the medication with the fact that it is a foreign substance that the immune system recognizes as toxic, requiring metabolism. It needs to be cleared from the body, just like any foreign substance, like a pollen or something. And so these two aspects of the body starts to become more and more antagonistic in time, because the immune system over the years become more and more hypersensitized against the medication, whatever the medication is bound to. And the energy medicine piece has been very helpful for me in terms of reinforming the body, whether it's the immune system, whether it's helping the body to know what to do about those extra receptors. It created on the cell membrane to prepare the body so that it's ready for a lowering of the medication, because the body has become codependent with that medication. It's waiting for that medication at a certain dose every day. So if you don't use energy medicine to help the body adjust, it's going to be one of the factors that make it very hard for people to withdraw from the medication, because the body isn't making adjustments the way it should. It's still expecting the same dose every day. So we use information, we use biochemistry, and we use our understanding of medications to integrate together to serve the needs of a unique patient at every point in time. This is something that you can only do if you're a holistic psychiatrist, not just a functional medicine psychiatrist who only works with supplements. You have to learn how to work with energy, because medications like benzodiazepines, antipsychotics, and stimulants work differently than medications like an SSRI. So an SSRI, you can provide some support to create serotonin. You can come down on the medication, and it's highly likely that the person can do pretty well without withdrawal. But with an antipsychotic that affects many different receptors, with benzos and stimulants that don't just block the reuptake of things, but actually pretend that they are those substances, when you lower the medications, you actually have to work on those receptors and change the number of receptors on the cell membrane.
Yeah, this, I as I'm listening, I'm in awe, because I really am, because I think about where we started off in psychiatry back in the day, burning people and saying they're witches, basically.
Oh, yes.
And then where we are right now, and where we could be if we could just get mainstream like psychiatry to evolve and embrace something that's really not new, but it's new to them, right? Energy medicine was there before. Energy was there. We are energy. Like, even if you don't see something, that does not mean that it's not real. It's like air. We don't see air, but we see the impact of air if you stop having it, right? And we have to be open-minded and explore the possibilities, because I just think what an amazing world we'll have if mental health wasn't the crisis it is right now, right? This mental health crisis. And part of me is saying that part of the reason it is the way it is right now is because our society has moved away from certain roots. Our world has changed. Our food has changed. The stress has changed. Many things have changed. So, as you journey with your patients, empowering them, how can you and the other care providers really help our patients take ownership of their mental health journey, particularly when incorporating the lifestyle, nutrition, and energy-based interventions? Because so often it seems like you go to the doctor and the doctor fixes you. And I don't like that approach at all. I believe it's a two-way approach. Yes, both parties are involved, but ultimately it's the patient who needs to take ownership of themselves. So how do we empower patients to move from being, let's say, doctor fix me pill dependent to explore the options that are almost limitless?
Yeah, lovely question. So I think most of the patients understand when they first have my free Zoom call, and I'm kind of wondering and checking to see if this is going to be a good fit with them. I always tell them it's a 50-50 interaction. I might have the empirical kind of experience, and be able to kind of guide them, but they have to do the work, and it's a lot of work. And so I want to make sure that the people I work with understand it's not just this doctor tell patient what to do with one pill and you're supposed to be cured. It's not an easy process. So only those patients who listen to that and accept it and understand it and actually embrace it are the ones that I work with anyways, because the people who don't, they're just, I've learned over the years that they're not going to lead, their treatment is going to lead to outcomes that are different from those who embrace their responsibility. The treatment itself, taking supplements regularly, doing a little bit of energy work every day is a discipline that helps them to grow in the process. So by the end of the treatment, they've really created a different way of understanding and taking care of their body. And there's just a whole different way of looking at themselves, because the treatment itself requires them to be responsible, to be reliable, to take supplements at a certain time, at certain times of the day. And as they, rise to the challenge, they do become even better than they were before and much more knowledgeable, because I always share with them, what the supplements are for and why they're taking it, because sometimes people have had a lot of nutritional deficiency or neglect before they came to see me. So if they want to speed up the healing process so it doesn't take forever, they do need to take a lot of highly absorbable supplements to start to restore the body. And I just tell them, you can take it and it will speed up the healing process, or you don't have to take it. But then your healing process will be a little slower. So you can take it and it will take care of the symptom, or you don't take it and the symptoms will continue. So they have choices.
Yes.
They're never left a feeling like I'm doing things to them or that I'm adding something that they don't want.
Yeah, that's important to know. Yeah. We all have choices, but you have to be committed to taking the supplements, because there can be a lot of supplements. Like even myself, who's, again, thanks to you and all the work you've done, I'm pushing the envelope and looking more. And today I was thinking to myself, I really should get a pill box, because I need to keep track of all these supplements, because it can be a lot. Plus, the regular stuff most people know to take in, the vitamin D's and, etc. But again, when you look at how you feel and what you can do with that newfound energy and your view on life and the shifts and the transformation in your lives, your relationships with yourself, significant other, work in society, and just growing, I feel that benefit is way greater than the quote unquote discomfort of having to take supplements, right?
Right. I agree. I took supplements quite significantly when I started this journey into holistic medicine. I would try the vitamin C and the vitamin D, and pretty soon I had a lot of supplements I was taking on a regular basis. And I took it quite significantly and regularly up until about 5 years ago. And what I discovered by taking a lot of regular supplements is that it was anti-aging. And I had, when I went through perimenopause and menopause and things like that, I had no symptoms. So I attribute that to regular supplement intake. More lately, I can't say that I've been taking supplements as regularly, but I think that it's been replaced with more energy medicine.
Yes.
So energy medicine also is very supportive of the body and its biology. So I think in some ways, I've shifted a little bit more towards using energy medicine techniques to really help with the biology of my body. But I do think that if people take supplements, they'll be really surprised at how it ameliorates what we expect would normally come with aging.
Yes.
Whether it's those wrinkles, the gray hairs, or whatever. And you can really change how aging affects you, just by doing some simple things. Yeah.
I completely agree, because, since I personally started this journey, I feel younger. I feel I look better than I did when I was in the peak of my stress. And it's just opened up opportunities, and also my patients, those who have entrusted me along this holistic journey. And by no means am I the expert that you are when it comes to psychiatry, but I'm like many people. I'm a learner, a lifelong learner, and I am so enamored, so in awe of the opportunities. Because if we are here right now, at this time, in this place, with knowledge, I wonder what it's going to be like 5-10 years from now, as pioneers are pushing forward, pushing the envelopes, and really challenging the status quo. And this, like you mentioned, aging. I refuse to accept aging, as in, okay, it's inevitable. Yes, we're all going to get older, but not in the model in which people present it. In medical textbooks, you'll see a young little baby, then a toddler, then the preschool. And then when they're old, they're like crippled and wrinkled and looking like the guy off The Simpsons, Smithers. Refuse. It doesn't have to be that way for the majority of people.
Yeah, I wonder about that. If you take care of your health, how aging really can happen for us. When I was telling this recent person that was new to my practice about how old I was, she was like, tell me your secret. Like, what supplements do you take? They immediately want what it is that I took because they think that they're going to get the same results. And I think that it's just really about understanding more about how to replace and how to replete, let's just say, our body when it needs, those antioxidants and vitamins and minerals. And we don't get that through food as much as we think we need, because I always tell patients, in what was it, 1917, and the iron content of an apple equals 26 apples in 1997. So you can't just take an apple a day to keep the doctor away anymore. You have to eat so many apples just to, just to get those the iron that you normally had with one apple back in 1917. So, and that's all in the data and in the literature. But I think that you're right. We just need to understand that the more we are humble and are open to learning, the more information we have to empower our lives and our families' lives to be healthier, remain healthy.
Yeah. Yes. There's always stories about, some 90-year-old or 100-year-old doing like marathons and doing all of these amazing things. And that just really is encouraging. But again, it's choices we make. And ideally, the sooner we start this journey, the better. If you start making healthy choices from, your 20s versus waiting until you have a major scare like a heart attack later on, I think the benefit would be great. But I mean, starting is better than not starting at some point and taking those steps to move forward. And, speaking of steps to move forward, like I remember when I first started coaching, which wasn't that long ago, and I have my website, Holistic Wellness Strategies. And you get the side role from certain people, healthcare professionals. They're like, what is this? But I'm happy to say that this term is becoming more and more acceptable. But in your field, psychiatry, which is very traditionally diagnosed with XYZ, you are drugged with XYZ. And not to say that these medications don't have, a place, stabilize a patient in acute setting. I'm not saying they don't have a place, but how have you dealt with the opposition? Because let's face it, those of us who are in the holistic functional medicine, in your case, holistic psychiatry space, we are actually the minority in health.
Oh, absolutely.
Like we are not the majority. Right?
Mm-hmm. Yeah.
How do you deal?
How do I deal with the traditional doctors? I give them their space. They have their space and they're happy there. What I do provide is free information for patients and clinicians alike, and I do presentations at different conferences. I'm in the process of writing my book that is hopefully going to share my journey as a human being and as a holistic psychiatrist. Yeah. So I think the information's out there. More and more, I think I've put together the puzzle pieces and the outcomes speak for themselves. So I have a podcast, The Holistic Psychiatrist is my podcast. And on there's a lot of patients who have been able to successfully come off their medications, and they describe their journey, and we talk about the different fields of medicine, like functional medicine and energy medicine, that's helped them to truly regain their health. So I think that the more this information is available, the more those who are open to learning will gravitate towards that, because it's out there. And those people who are open will find out about the conferences that they can attend, be able to start integrating all of these different things together. I think at this point, there's a lot of clinicians who could probably take a shortcut and learn from me, and they don't have to take 20 years to do what I do. They could simply just learn directly from me in terms of how to integrate everything together. But I think that if they want to learn from scratch and go step by step with first functional medicine and then evolve and integrate energy medicine, that's a wonderful path as well.
Sounds beautiful. And I look forward to the day when this energy medicine, functional medicine is a prerequisite in medical school, integrated in all residency programs. It's just how we do life. See disease as not just a single state, see as a system response, and what are the factors in place.
Yeah, I think it's going to also have to integrate, social changes, like how we grow our food, right?
Oh, yes. That's another, putting toxins in our food, these red dyes and cancer causing things. Yes, that's another conversation.
There's so many fields that need to also work with us, because we have the legal aspects, because as a holistic psychiatrist, when you're a maverick, when you're a pioneer, you're doing certain things to help patients and doing the best you can, but anything that is not traditional psychiatry is more vulnerable.
Yes, for sure.
To legal assaults. And I think that when the legal aspects of being a holistic physician, being able to bring additional energy, information and help to the patient could be thought of as a good thing, as opposed to, being
competition,
either competition or just being misinformed or whatever. I think then you're really going to see a lot of doctors who've been afraid to practice as holistic practitioners because they're wondering whether they will be able to keep their practice and their mortgage and be able to have their job and be able to support their families if they go into a holistic route. If that isn't something they have to worry about, then I think a lot of physicians will go in that direction.
Yes, I think more and more. And I'm grateful for the pioneers who stepped out and pushed the envelope. Continue to yourself. You have a podcast, you're regularly producing content to clients, you're writing your book. And I know there's way more to come for you because like you said, you look like you don't look your age. You look great. You have energy, you're spunk. And I like that. And I think as long as we keep on pushing this message out, making these terms become normalized, we'll move forward. It wasn't that long ago, vitamins were seen as, what is that? Like, what are you doing? Why things? Now it's a multi-billion-dollar industry in supplements, et cetera, et cetera. So if it's not a Pfizer product, maybe it's some other alternative brand product, right? But
I always think that proof is in the pudding, right? If it works,
is in the pudding.
If it works, then you're going to get lots of people who step up and say, I went through this route and I felt so much better. One of my patients wrote a book on how to get off stimulants, and one of my the patient who got off 6 meds is working on our TEDx talk.
Wow.
So there's a lot of patients out there who've gone through the journey and they want their messages and their stories heard. So the more we have people sharing their stories out there, the more people are going to say, let's go the holistic route first, because why start with medications if you can prevent, illness?
Yes, I know. Recently, just this week, I talked about prevention, and I think it's better than the cure. I think prevention is amazing. Creating an optimal environment for our genes to express themselves, for our minds to flourish, our lives to flourish. And like you also said, we need to tackle the food industry and what's going in our food, because that's also part of the challenge. Like you mentioned, the apple of today is nothing like the apple of 100 years ago. Right. Apple a day will not keep the doctor away. We will be there.
Yeah. That's why I think obesity and problems associated with obesity has been also increasing exponentially in alignment with mental illness. Both 100%. Are kind of integrated, I think.
Yes.
As underlying causes, right?
Yes, they're connected. They really are. But I think if we look at really the root causes, it's actually for majority of cases, quite basic. We just have to make those changes. We need to, food needs to be regulated. We need to change the way we see life and even our relationship with. But anyway, that's a whole new topic. But I just want to say, I appreciate you being here. Honestly, you have brought so much. It's like, how would I even put it? You've opened a world of opportunities in my own life along my holistic journey, and you've helped me save those years that you had to go through. Like, I don't want to do 20 years in the wilderness. Like, I want to learn from you and really just grow. First as a patient, because that was my first experiment along this holistic journey. It was my own situation with my own mental health, my own life, and then looking at my patients through a different lens and going, you know what? I'm not sipping that Kool-Aid no more. I like this one. I like this well. I like this one. I like this spring. And that's where we want people to go.
Absolutely. I think most of the holistic psychiatrists or physicians out there would have continued with a more traditional route if it hadn't been their own life challenges that allowed them to be open to more of an alternative or holistic approach. So I think we're coming from that angle because the way we're trained is to think traditionally, but something has to kick us out of that
100%.
traditional path, right? And
Yes.
it's usually because we need it.
Yes.
We find the answers for ourselves.
Yes. And then you just question the status quo. And then when you realize that this route feels better, it is better, it's really hard to go back to the other one without feeling a little guilty. So, you got a choice. Either stay in the box, or open up and explore the amazing opportunities in energy medicine, holistic psychiatry, all of these approaches, because it's the way of the future.
Yeah. Well, as a family physician, you know that you deal with the majority of mental health issues. Like family physicians are the first line individuals who deal with mental health issues. So it's not the psychiatrist per se. So I think that anything in holistic medicine that you can use to help either prevent, mental health problems or to curtail them without having them go right to medications is a wonderful set of tools for any family physician.
I accept that, and I embrace it and the journey of education, exploration, and learning, not just from myself, but also the thousands of patients who call me their physician, and even my coaching client. So thank you for those words. Dr. Lee, how can our viewers contact you if they want to become, let's say, a potential patient or just learn more from your wisdom?
Well, I have two main things that I would refer to them. My podcast, The Holistic Psychiatrist, has a lot of testimonials and information. There are writers and physicians that are on there that you can always enjoy. My website is really the place where everything is kind of organized. Yes. So my podcast is there, and it's called my podcast is holisticspsychiatrist.com. And there's a contact section there where if you contact me, I'll get it in my email right away. I'm not much of a social media person, so even though I post my videos on there and I have my videos on YouTube and audio on podcasts, I don't think you really will be able to quickly access me through a social media app. So the best way is to contact me through my website.
Love it. Your website is chock full of information. It's well laid out. So again, Dr. Lee, thank you for being here, my soul sister.
No, yes.
I think you're amazing.
I think you're amazing too.
Thank you. And to our listeners, we wouldn't have this show without you. Otherwise, we'd be talking to ourselves. And I know we're not. Every week, you're downloading and listening. So please share. Let's look at health differently. Let's look at prevention differently. Let's take ownership of our lives. Ultimately, we own our bodies, regardless of what's going on around. We live in a place, thank God, in a country where ultimately, to a large degree, we have autonomy. So those little steps, whether nutritional, lifestyle, stress management, energy-based interventions, embrace them. Till next time, this is your host, Dr. Tomi Mitchell, and our lovely guest, Dr. Alice Lee, on the Mental Health and Wellness Show. Bye.